evening and Paddy nice life in the Philippines. Yes, we're back again. We went for a break, but I'm trying transmission today. But finally someone the courage to meet. So yes, so if you join in, thank you, thank you, thank you. I can see you. Thank you. I know we are going to have a good my guest already is already with me in the studio. Just to show you how we are. Like he's already with me. Okay. I hope you can hear me with me in the studio here and time before him up and you start dishing out value, you know. I know there's a lot I know you you honestly really well. So one I think you're using my name. So this is what she shouting. I know that she shouting but just in case but in case you the aim of the health talk with Vahrashee. You know, the health talk with Vahrashee is like rate of growth, you know, just and that is why I feel like growth, you like knowledge and like you know that's the best combo. The aim of the health Vahrashee. So I'm healthy. So and around that are for health because kind of economy and I know for the fact that you're healthy, I'm telling you, you need to be grateful. Right? Patients will come here. Yeah, like patients come here and they have things that in some but in the head of Vahrashee. Tonight this emergency, there's this time that emergency phone. Yes, I don't know. Okay, is it clear? Please, if you can hear me and see me, that you can see me. I'm dropping the comments and see. Can you see me? Yeah. Okay. Let me assume that you hear me and type in the comment section. Me. Okay, hear me. Thank you. So, I just have to keep time. So by 8:30 on the dot, I'm bringing but read a brief guys, I think so. You must so much call not Martinez maybe it's professional about healthy living, tech, and markup. I guess I can do that. It's a core experience of my ensuring every contributes to the day is sweet. Demonstrating a knack for leadership played pivotal roles. President reporting wow to date. This is the integration of diaspora training analysis. The local chief of Crony Academy of Nigeria full energy toward through skills acquisition and financial development. Deeply committed to human recently technical profession, aiming to improve the and create outcomes. With interested but eager to engage in on innovations and just as Martin will be speaking tonight. Bring it to his space. Nas Martin will be speaking to us this night. Yes.
Good evening. Good evening.
Yeah.
I hope you can hear me loud and clear. Yes.
Yes, I can hear
Awesome. Awesome. Good evening, everyone. Good evening, everyone. Can we know
you.
those
It's nice
that?
to
Thank you very much. Thank you very much for having me for the invite. It's a pleasure to be here. I hope you can see me clearly. Yes.
we can
Okay. Okay. Is there a way we can know the people that are on the stream right now? Can we know?
see the people. They drop a comment.
Sorry.
There's a comment. Not know who is, I can see on them, but until the moment I cannot know. So please kindly drop in the comments so that I get to know your name, what you're from, if you're from YouTube. Thank you. Uh, we're waiting for them.
Yeah, so if you're live with us, we'd like to see your comments. We'd like to, let's know.
I think I can you hear me? I cannot hear you. I think you try muting yourself. Let's see. In our country we are. Yeah, we do encounter.
Yes, yes, I can hear you now. I hope you can hear me. You can hear me, yes?
I can.
Awesome, awesome. Okay. So, good evening, everyone. I hope we are doing well where we are. Thank you very much, Vahrashee, for this honorable invitation. It's a pleasure to be here connecting with people from your community. Thank you, thank you, thank you. Yes, I am really interested in this topic of discussion tonight because um, with the mortality rates still increasing, ever increasing, both within and outside Nigeria, it's imperative that we sensitize the public to know how to respond to emergency situations. And let the public know, okay, we educate the public on how to be better prepared for when things happen. I remember, I think it was sometime last year when there was this video that was circulating. If I'm not mistaken, a woman was dancing and she suddenly collapsed. Right now, when she collapsed, people didn't really know what to do or how to respond to it. Right, and that was how the woman ended up losing her life. Imagine somebody goes for O and bear, right? And the person doesn't come back home. What happened? She's stumped. I mean, imagine how the host of the event would have felt. It would have been, they would have been devastated to know that such a thing happened at their event. So there are things that people need to be prepared for, right? There is this light joke where let's say where in Nigeria when somebody suddenly collapses, the first thing the average Nigerian does is to go and get water and start pouring on the person, right? We don't really know how to respond to such a situation, to such persons, right? How to make sure that they are safe. We've had situations, we keep having situations where people are choking, people are having issues, and people are stunned. They don't know what to do. Instead, people will gather and they'll gather the person, and at the end of the day, more often than not, people lose their lives as a result of this, right? So it is absolutely imperative that we get the average citizen, the average Nigerian, the average human to be better prepared for well prepared for emergency situations. What do you do when something like this happens? What do you do when someone just collapses? What do you do when um someone is talking? What do you do when someone just faints? There are different situations. Okay, what are the basic things that you should have around you? How do you differentiate what from what? So these are what we're going to be talking about this evening. Vahrashee, please let me know. Please help me keep. I'm going to be keeping track of time as well. But let me know when we're talking too much. Okay, so we tend to do that a lot. So yes. Vahrashee, are you there? Vahrashee, are you there?
With you.
Okay,
Right on.
okay, okay, great. Okay, great. Um, okay. So yes, let's start by laying a few basics, a few foundational, fundamental knowledge. Right? What exactly are emergency situations? Wait, I would like to know. I like interactions when I'm speaking. I prefer interactions. Can we know? Yes. Can we know those that are online? Let's hear from you. What do you understand by emergency situations? What are emergency situations? We can't talk about emergency response without first knowing what an emergency situation is. So, what to you is an emergency situation? Can we just give 30 seconds to see if we can let's see response from our audience. What are emergency situations? Are we here? Let's see. Our amazing audience. Let's see. Okay, just one. Now emergency situations are simply put urgent. They are simply put urgent, unexpected, usually dangerous events. They're usually dangerous situations that they are unplanned. They just happen spontaneously, and they are usually more often than not life-threatening. Okay, emergency situations are situations that put the lives of individuals at risk. Right, a person will lose their life if prompt actions in. Okay, that's why they are emergency situations. That's why they are referred to as you don't go to the hospital as someone who is at the verge of collapse, and then you go to the general outpatient department, or you just go to any of the ward. Instead, what happens is you go to the emergency, the accident and emergency. Usually, that's what's called. Depending on how yeah. Can you still hear me? Okay, depending on where you are, right? And then there you meet someone, a medical professional who will attend to you immediately, right? Because if they don't attend to you immediately, you stand a chance of crossing over to the great beyond, right? Emergency situations are situations that require prompt actions. Oftentimes, if there is no action within the 2 to 3 minutes, the person, the situation will get really bad. That's why it's absolutely essential. We cannot overemphasize. We cannot stress this enough, right? It is important that people are really aware. They are equipped with the knowledge, the skills, the competence to respond effectively to emergency situations. Yes. So emergency responses basically are what we do when situations, how we respond when situations like this occur. Right? When these life-threatening situations occur, what happens? Okay, do we stand around the person and we start pouring water on the person, or do we start taking videos? See what happened today. What do we do? Right? It is good we know what to do in situations like that, such that we can improve the chances of people's life being saved. Okay. In countries where we have emergency response numbers that really work, that we're used to. I mean, a lot of us watch American movies, right? And then we know what 911. I don't know if 911 works in Nigeria though, but do you actually know that in Nigeria we have an emergency response number that actually works? Yes, it does. The first time I got looked at about it, it was mind-boggling. But imagine my surprise. There was an accident. I was passing. There was an accident um, along the road, and I called the number. And imagine the shock. I mean, as a nurse myself, I was surprised to know that okay, in Nigeria, this number actually works, right? All you need is just to dial 112. Yes, so dial 112, and you have access to an emergency responder, right? They will send the required emergency services to the location where you are, because they're going to ask you a couple of questions to know the situation, and then but this is something that people don't know. And because of that, when people have accidents on the road, a lot of people don't know what to do. They don't know who to call. They don't know how to go about helping the person actually recover. Right? Imagine now that you have this knowledge, you're going down, you're walking down the road, or you're about to, you're traveling from your home to your place of work, or whatever it's going, whatever is happening, right? You're moving, and then you see an accident on the road. Now there's no need for you to fret. There's no need for you to be scared. There's no need for you to be anxious. All you need to do is pick up your phone, 112, and someone comes. NEMA response. Okay, that's the Nigeria Emergency Health Agency. Something like that. I don't understand. NEMA, right? They actually respond. People need to know this, right? Again, we actually have this knowledge until we actually have the skills that we can actually begin to, help people to recover from. Oh, I'm too fast. Okay, so thank you very much for that feedback. Thank you very much for that feedback. I'm going to try to slow down. When I talk, I tend to talk pretty fast. So, yes, I'm going to try to slow down a bit. Okay. So yes, I was saying it's good we actually, get people to appreciate the knowledge, to learn, okay, obtain the knowledge, and then apply the knowledge needed to save lives. Okay. Imagine in situations like that, there is nobody. An accident happens. There is nobody with um, emergency response skills or knowledge or competence, and nobody knows how to do basic first aid, and you pick your phone. The time it will take for the emergency response team to actually get to that location, it's a challenge on its own. They could be met with things like traffic. Even in a Nigerian context, network lately has been pretty bad, right? So imagine having to call, like calling good Samaritan that you are trying to call such that you can help somebody save the person's life, and telecommunication companies decide that it is that day that their grid is going to go down, right? But before the emergency response team arrives, there are things you can do as an individual. There are things that you can do as a citizen, as an average person, as someone who has compassion, who has concern for a fellow man's life. Okay, again, tonight's session is going to be just about that. Okay, we're going to be talking about a few emergency situations and how you can respond. Okay, I hope I am my speaking pace isn't too fast. I hope it's a little slower now, right? We can keep up. Yes, can we? Okay, I'm going to take it that we can. Okay, so yes, now as is with a number of other things out there. Okay, there are principles that guide emergency response. Okay, there are principles, we call them the protocol, that guide emergency response. Or yes, that's the number 112. Yes. So there are principles that guide the protocol, the emergency response protocol. Okay. The protocol says slow down to a level. Okay. Um um okay, please. In case you have any questions, right, as I'm speaking, just drop the question, your reaction, drop it in the chat, and yes, I will take time to I'll just take a pause and then respond. Okay. So please drop your questions. Okay. Yeah, and I'm going to slow down. I'm going to slow down even more. Okay. So there are okay. Okay. So there are protocols. Okay, there are things, principles that guide emergency response. Okay. How do we know that this situation is one that requires emergency response? You apply the protocol. Okay. You apply the principle. Okay. What does the principle say? Okay. The principle says you should call for help. The principle says you should make sure that the surrounding is safe. Okay. The principle says that you should apply the ABC protocol. Okay. What does A mean? ABC, the normal alphabet. A stands for airway. Breathing stands for B stands for breathing. C stands for circulation. That's the blood flow. Making sure that there's sufficient blood flow. Because oftentimes in emergency situations, the vital organs are the organs that we need to make sure that they are functioning. Vital organs, the brain, the heart, the lungs. Okay, these organs need to be fully functional in every emergency situation, because if the heart is not pumping, blood will not get to blood will not get to the brain, and if blood doesn't get to the brain in 3 minutes, 2 to 3 minutes, study shows that the brain will begin to die, and when the brain dies, that's why you hear is in sometimes in movies and what that somebody is now in a vegetative state because the person has experienced what we call brain death. Okay, the brain can die. The person will be you say that the person is alive. The person is neurological functions, physiological functions are still happening. You understand? But it is essential that we apply the ABC. Two things: if blood doesn't get to the brain dies. Now, why is it essential that blood gets to the brain? That's because the blood carries two very important things. One, oxygen. Two, nutrients. When there is shortage of oxygen supply to the brain in 2 to 3 minutes, again, without negotiation, the brain begins to die. So that's why it is essential that when we come in contact with emergency situations, okay, we actually apply the ABC protocol such that we can arrest the situation, and we are making sure that oxygen supply is steadily being sent to there's steady supply of oxygen to the brain without interruption as much as possible, and there is sufficient blood in the system, in the body system. I think the adult human carries about 7 to 8 liters of blood. Right now, in a situation whereby the amount of blood in the body of the individual is less, you don't expect that the oxygen will be enough, will be able to receive as much oxygen as it needs to function. I hope you're following the logic here. So it is essential that we apply in every emergency situation. We apply the ABC protocol. Now, for our session tonight, we'll be looking at three emergency situations. Okay, we'll be looking at bleeding, what you should do in bleeding situations, what you should do in choking situations, and what you should do in cardiac arrest situations. Okay. Now, before I begin, I'd like to throw this question out there. Right? Yes, I'd like to throw this question out there. What is the difference between cardiac arrest and heart attack? What is the difference between cardiac arrest and heart attack? Okay. If you know the difference, I'd like to put it in the comments. Okay, drop it in the comments, and then by the time we get to that point, we'll go into it. Okay, now back to our discussion. First, choking. Okay, now in a situation whereby you come in contact with someone who is choking, how do you know that the person is choking? Right, that's the first thing. In every situation, you have to first of all do an assessment. Again, talking about the emergency response protocol, you need to do an assessment of the situation. Okay, is a person trying to grab hold of their neck, they are finding difficult to cough or to breathe, right? These are signs that you see that okay, the person is choking. You are talking to the person, are you okay? You're asking the person, are you all right? And the person, you see that the person is finding it difficult to actually breathe or to actually speak, to respond. The person is agitated. Okay, you see that the person is finding it difficult to breathe. What do you do? Right? First, one thing you can do is to stand behind the person and give the person a blow. I'm not saying punch, okay? People like us that have big fists, I'm not saying punch, so that you don't go and break someone's spine in the name of trying to remove what is choking. Okay, so calm down. I'm saying, what you do, the heel of your palm, you can use it to hit the person's chest, the back of the person, right? In an effort to send vibrations such that whatever is stuck in the person's airway can come out. Okay, you give the person a couple of blows to the back. I mean, serious blows. Again, not a punch. There's a difference between the effort you put in a punch, like when you activate violence. That's what we're referring to here. We're saying a blow. Apply force, apply pressure, yes, but use the heel of your palm. Okay, when you do that, you are sending vibrations such that again, the vibrations are what will push whatever it is that may be obstructing the airway so that it comes out. You understand? Now, people have this this thing about putting their hand in the but don't do that. Don't put your hand in the person's mouth. One, the person bites you. The person can bite you. Okay, don't do that, please. Secondly, you don't do that because in the process of putting your finger in the person's mouth, you could actually end up pushing whatever it is further down the airway, thereby causing even more problems. Okay, so like sometimes when you are eating, right, somebody begins to choke, right? You see that somebody begins to choke, right? First, you go to the person again, assess the situation. Are you okay? Are you all right? The person is still, struggling. You just go to the person's back and you begin to hit the person. You begin to, send some blows to the person's back. Right? Now, as you do that, if you see that whatever is lodged in the person's airway is still not coming out, okay, what you can do is what we call the Heimlich maneuver. The Heimlich maneuver. Okay, this is where you make a fist. Okay, you make a fist with your two hands. I hope you can see what I'm doing. This is one hand. Okay, this is second hand. Now, this hand like this, remember you're still standing behind the person, the back of the person, right? You put this fist now at the middle of the person, what we call the medial sternum, right? Just under the medial sternum, the person's ribs at the very button in between the ribs, right? What you do there is you put your fist there and you press inward and upwards. Okay. Let me see if I can lower my camera so you can see me demonstrate this. Yes, emergency response in case of sudden collapse. We'll get there. We'll get there. Okay. So I hope you can see me. Um, you put your hand. That's the fist that you've made. Remember, this is one fist. This is the second one. You put it at the medial sternum, under the medial sternum. Again, in between the ribs, at the middle of the chest there. You know that place where it's like as if the ribs are coming up and then it's going back down again to the other side. That middle there, you put your hand there, okay, and then you do push inward and upward. Again, you apply force. Don't just, you're not trying to massage the person. So, we're not saying break the person's bones, but do that. Okay? As you are doing that with force, you are pushing it inward and upward. It's sort of like going like this. Okay, you are as if you are making a V or a U shape, right? It's inward and upward, inward and upward. Now, as you're doing that, you are creating a force. Okay, again, sending vibrations to help push out. Again, to help push out, whatever may be lodged in the airway. I hope that's clear. Now, that's how you respond to what's it called, choking situations. Okay, that's how you respond to choking situations. You can, do the backward blow, send some blows to the back, and then you can do the Heimlich maneuver. Again, put your fist at the under the medial sternum, and then you push inward and upward. Okay. The second thing you do, the second emergency situation we'll be looking at is the situation of hemorrhage, bleeding. Okay. Let's say Nigeria now we've been hearing a lot about both known and unknown gunmen, right? We'll be hearing there are a lot of situations around, and or let's say someone has a road accident and the person is bleeding severely. What do you, right? The second thing we'll be looking at, okay, hemorrhage. Now, what you do is again you look at the environment, make sure the environment is clear. Okay, there is nothing that can cause further damage or further hurt to either yourself or to the patient. Okay, yes, you are now a makeshift nurse. No, you're not a makeshift nurse, you are an emergency responder. Okay, so the person you are caring for is a patient in that situation. Okay, yes. So now what you do in that situation is first you assess the environment, make sure that the place is clear. Okay, and as you see that the place is leaking, what you do is you apply pressure to the place and you can apply a tourniquet. Now, for as many of you that remember you go to the hospital and they want to take your blood sample, they want to take some blood or they want to give you some medications through your vein. There's that rope that they will first of all, the nurse or the caregiver or the scientist, whoever, will first of all tie around your hand very tight so that your veins will stand. You understand? So that it will be easy to just puncture. Right? Now that rope that they are tying is called a tourniquet. Okay. Now you can apply the same tourniquet in the situation in cases of bleeding, severe bleeding. Okay. Let's say there's a bleeding over here. Now what you do is you come up, right, above that spot and you tie a tourniquet around it. Now, in a situation whereby you don't have such a rope, you can use any rope really. Okay, anything that is easy to twist, anything that is it's strong and easy to twist, right? It's not advisable you use your belt, but you can use like a cloth, your scarf, your wrapper, your tie, for the men, your tie. You can use that, even a long and elastic socks. You can use that as well. Okay, you tie it around very tight. There is a procedure for this. You tie it around very tight. Okay, and when you do that, when you tie it very tight, you actually get two sticks. tight as possible. Okay? To make it as twisting and twisting and twisting that knot till you see that the bleeding has stopped. Okay, till you see that the bleeding has stopped. Now, again, in all of these things, make sure before you start doing your intervention, you have called 911 if you are in abroad, or you are in Nigeria 112. Okay, make sure you call them, and so that while you are doing the providing first aid, you are trying to balance the person and stabilize the person. Rather, these guys are actually on their way so that they can provide further care to the person. Now, in a situation whereby there's something we do as Nigerians, when it is that someone has a fracture, right? The bones break or they dislocate. We have the habit of the first thing to do is to try and align it by ourselves. Please don't do that. Okay, someone has an accident, there's an emergency situation, the person is bleeding, and you see that the bones are fractured, and please don't try to realign the bones. You could actually make things worse. Okay, because the veins, the blood vessels, and everything right now is not in the order that it should be. So a specialist, we have to go in, you have to do some investigation, your x-ray and all of that, to make sure that they are going in, guided. You understand? So don't try to realign yourself. What you do instead, you can get, if you have like a carton, you just provide some restraints, to support the let's say it's a leg, for instance, just provide some restraint to support the leg, that area that is fractured, right? So that it doesn't get separated, or it doesn't get disconnected even further. What you can do is you can get like a carton and then some sticks. Put the sticks by the side. Let's say it's the leg, for instance, right? You can put the sticks by the side of the leg, use a carton to wrap, and then you just, let's say there's a fracture here, right? The bone here is broken, for instance. You can put a carton. Okay, let me see. I should have some papers here. Give me a moment. Okay, so let's say this is a carton, for instance, right? You can put a carton like this. Okay, now here and here. Remember, the fracture is somewhere around here, right? So here and here, you already put the carton, you put the sticks, okay, just tie it so that the sticks and the carton will provide support again, such that it doesn't fall off. You understand? Like the distal part of the dislocation of the fracture, it doesn't fall off, it don't cause further injury and all that. Okay, so that's another thing you do in the case of hemorrhage. Now, in a situation whereby there is something that punctured the person, let's say it is a road traffic accident and a piece of, let's say, the windscreen, punctures the person, it stabs the person. What do? Please, by all that you, in the name of all that you hold secret, do not remove that thing. Okay, what you can do instead is, as you're applying pressure on the place, okay, you can just use some clothes and all of that to just up around that thing, that is, apply pressure around the thing, that's the sharp object. Now apply pressure around it, press it down, but don't remove it. A specialist will go in guided to remove it, because what you do sometimes is, by removing it, you are actually causing problems. Okay, by removing it, let's say it punctures, it goes through the blood vessel. By the time you remove it, the blood vessels are exposed, right? So all the blood begins to pour out. Again, the body needs enough blood to function. If there is not enough blood to transport oxygen to the brain will begin to shut down. Wahala. Okay, so it's good you actually pay attention to these things. Now, what you can do instead, like I said, you leave it there. Just apply pressure around the place, or leave that object there. The specialist will go in guided. Imagine when the sharp object is piercing the lungs, and you go ahead to remove that sharp object from the lungs. What you cause in that situation is you cause positive pressure. Now the lungs function is able to expand and contract. Get big blow, what we call a negative pressure. There's a negative pressure, that is the negative pressure inside that causes the lungs to function as should. So by the time you remove this thing, you apply positive pressure. Positive pressure will make the lungs to collapse on itself. So you that is trying to be the good Samaritan to help the person, what you have only succeeded in doing by removing that sharp object, by causing is causing more harm. Okay, so it's good we pay attention to these little things, because it is the little things that actually matter the most at the end of the day. Okay, so again, in case of hemorrhage, you tie the place. You try as much as possible to inhibit, to stop the blood flow. Okay, apply pressure on the place, around the place. If there's a sharp object, do not pull out the sharp object. To apply your tourniquet and make it as tight as possible. If you go on YouTube, there are videos, several videos actually, on how to actually apply a tourniquet properly. Okay, or how to perform the Heimlich maneuver in case of choking situations. Okay, now I hope that's clear so far, because the next one I'm going into now, that one is we are actually going to stay there, because we're discussing a couple of different emergency situations. So I'm just going to take a pause here, and for a minute or two, I'm just going to see if we have any questions. Any questions? Vahrashee, do we have any questions so far? Okay, I hope we are learning though. I hope we are actually uh, finding good value for our attention that we are paying. Our attention, if you don't know, is currency. So you're actually paying you're actually paying us here. Okay, thank you very much for your payments. Vahrashee, do you have any questions so far? Okay, I see a comment here. Cardiac arrest and heart attack. Okay, yes. So the question that I asked, cardiac arrest versus heart attack, what is the difference? Please, in case you haven't responded to this, respond to it quickly. Okay, what's the difference between heart attack and cardiac arrest? Okay, what's the emergency response in case of sudden collapse? Yes, we're coming to that next. We're coming to that next. What do you do when someone suddenly collapses, like the woman that collapsed and passed away last year, right in the middle of O and bed? Life can be so. Okay, so any questions from anyone? Okay, so we'll just proceed then. Okay, now in the case of sudden collapse, what do you do? It's good we know that there are different reasons why a person can suddenly collapse. Okay, it's not automatically that because somebody collapsed, then it is by default cardiac arrest, or by default heart attack, or by no. There are different reasons why a person can collapse. Okay, one of the reasons why a person can collapse is sakpa. Yes, hunger makes people collapse. Medically speaking, we call it hypoglycemia, when there is not enough glucose in the blood, in the body, for the body to use to function. The brain is asking, the brain needs energy to function. You are not supplying energy. What do you want it to do? It will collapse. It will go unconscious. Okay? That's why if you notice, for those of you that did, those of us that did sports in like primary school, every time they are doing inter-house sport, there is always glucose on ground, such that people will not collapse. Because the moment somebody collapses, you will now begin to struggle between differentiating between collapsing because of hunger versus collapsing because of heart attack versus collapsing because of heat stroke. Because just get sugar ready. The moment the person starts feeling dizzy, you give the person a spoon of glucose, and the person is all right. No collapsing for you today. Okay. So one of the reasons why a person could faint, a person could just drop and collapse, okay, is hunger, hypoglycemia, a situation whereby there is low amount of sugar in the blood. Okay, that's one reason. Now, before this happens, oftentimes there are typically indicators to such situations. Okay, one of the things that happen is the person starts feeling dizzy. That's one thing that could happen. Okay, the person starts feeling dizzy, and then the person will, because the dizziness is the brain telling you, I need oxygen, I need energy, I need glucose, I need glucose, I need glucose. When you refuse to supply the glucose, it drops, right? So that's one reason. Another reason why people collapse is heat stroke. When the heat is too much, the body has what we call, the body is able to regulate the temperature. There's a system in the body that regulates the body's temperature. Okay, it is this system that is responsible for your sweating, for your feeling heat, for your increase or decrease urination. Especially in hot seasons, you see that you're constantly thirsty, you're constantly sweating. This is all what we call the process of homeostasis, or homeostasis. Right? Yes. Okay, so that's the body is trying to regulate, the body temperature. Okay, now what happens in this situation, when there is heat stroke is, as you're feeling heat, the body is, trying to cool itself down by sending water that is already in the body system out to the skin. Again, remember, the heat usually comes from outside, right? So it sends water out such that it can cool the skin down. Now, in a situation whereby you are dehydrated, there is no more water to send out. In that situation now, what happens? There could be a heat stroke. The person will collapse. Again, in situations like that, look at the environment. The weather is usually very hot. Okay, the person very dehydrated. Okay, which by the way is another reason why people collapse. Yes, dehydration causes people to collapse. Okay, um, um, the person could be dehydrated. That could cause the person to collapse. Um, I just lost my train of thought there. Sorry. Okay, so dehydration, okay? Dehydration, heat stroke are reasons why people collapse. Another reason why people collapse is stroke, what we know as stroke in itself. Stroke occurs when there is no, remember we said when there is no sufficient oxygen supply to the brain, within 2 to 3 minutes, it begins to die, right? The brain cells begins to die. Now, what happens in the case of stroke, okay, is that for whatever reason, which could sometimes be because there is blockage in the blood vessels, the arteries of the blood. We have three different types of blood vessels, right? We have the arteries that carry oxygenated blood. We have the veins that's oxygenated blood from the heart to parts of the body. We have the veins that carry the oxygenated blood from the other parts of the body to the heart. Okay, and then we have capillaries, the tiny, tiny blood vessels that branch out into the like your fingers and this. It is the capillaries that when you cut, okay, that's what begins to bleed. The capillary has broken. That's why you're bleeding. You understand? Now, when you're going for injection into the veins, it is the vein you're going into. Okay, we have emergency medications for going into the artery, like adrenaline. Those ones are, real emergency situations that you cannot handle. Okay, so in such situations, remember to call 112 so they can handle it. Okay, now coming to the question of heart attack versus cardiac arrest, right? Okay, so for the heart to pump blood to all the parts of the body, right? It requires makes use of electrical conduction. Yes, there is electricity, electric currents, like a NEPA light, a very, very micro voltage, okay, that is sent through the heart muscles. That's what makes the heart to contract and to relax. To contract, that's what we call beating, right? It is the electrical current that causes the heart to beat. You understand? Now, what happens in the case of heart attack, or in the case of cardiac arrest, okay, is that for whatever reason, there could be a number of reasons. Sometimes it is not even your fault. Sometimes you are on your own. The heart on its own will just start beating anyhow. The electrical conduct, like the way NEPA will just on their own begin to show themselves. So also sometimes the electrical conduction of the heart begin to show itself. Okay, so yes, 112 actually works in Nigeria. I can attest it to that. Okay, I have used it. It has worked. Okay, so yeah, in cardiac arrest, for whatever reason, the rhythm of the heart is thrown out of balance because the way the electrical signals are sent to the muscles of the heart is distorted. Okay. Now there is an approach to remedying this situation. When this happens, oftentimes the blood that is supposed to be pushed to the heart is not pushed to the brain. It's not the time it's supposed to take to push it out. The effort is not when it's beating faster or it's not really there's no rhythm to the flow anymore. It's not the heart muscles of the heart, chambers of the heart are not able to gather enough pressure with which to push. So blood doesn't really get to the brain. Okay, this is what causes people to collapse. Okay, in that situation, what you do is your CPR. Okay, we will come to CPR in a bit. Let's talk about heart attack. Heart attack is different from cardiac arrest, oftentimes mistaken for the other. They are oftentimes mistaken for the other. Okay, but they're two different things. Cardiac arrest is because of electrical currents. Heart attack, on the other hand, is because the muscles of the heart itself. Remember, we said in cardiac arrest, it is electrical currents, Okay, it is electrical current that is misbehaving in the heart and is now preventing the heart from pumping blood and oxygen to the brain. Right? So that's what happens there. In heart attack, on the other hand, the muscles of the heart begin to die themselves because oxygen is not being supplied to the muscles of the heart. I hope that's clear. Okay, so you could be on your own. This could be due to choking when there's not enough oxygen. This could be as a result of too much fat. When we talk about high cholesterol level, okay, it means that fat has deposited in the blood vessels, in your artery, in your vein. So because of that, now blood is not able to flow properly anymore. Okay, blood is no longer flowing to the heart muscles, and because of that, the heart muscles. When there are no healthy muscles, there is no way you expect the heart to beat. Okay, and that is what happens in a situation of cardiac arrest, in the situation of heart attack. Okay, heart attack happens because the heart muscles begin to die. So when we say there are different grades of heart attack, on the other hand, which comes in further analysis and all of that, but in a situation whereby somebody suddenly clenches their chest and heart attack, unlike cardiac arrest, actually has presenting symptoms. Okay, cardiac arrest actually heart attack, however, sorry, heart attack, not cardiac arrest, heart attack actually have some presenting symptoms. Okay, it can happen almost immediately. It takes a little, it has a little window where it presents some symptoms. You begin to have a chest pain, usually on the left side of your chest. Okay, it could radiate to your shoulder and to your neck. Okay, now when you begin to have that pain, what you begin to do is what happens, you begin to suspect that there's heart attack coming. The heart muscles are beginning to starve of oxygen. What you can do as an emergency response in that situation is to increase your respiratory rate, taking more oxygen. You understand? Taking more oxygen, because again, the heart is sending you signals. I need oxygen. I need oxygen. I need oxygen. I need oxygen. That's why you begin to have that pain. Okay? So in that situation, you begin to take in more, increase your respiratory rate, and don't do shallow breathing. Take deep breath so that you can breathe in enough oxygen. Okay, breathe in very well. Yes, and take in the oxygen so that the heart can get the oxygen it needs. Of course, you do this, you try to sit down. Okay, you do this, and as you do this, of course, you called 112, 911, whatever the emergency number is, such that they can send someone and you can receive proper. Okay, now again, remember, emergency response is not the complete management. It is just a first line management. Okay, it is just stabilizing the person so that the professionals can have a living human being to actually provide care for. Understand? Okay, so in that situation now, you've called 112, you're taking deep breath, or somebody tells you they're having it, you encourage the person to take deep breath and all of that. Another thing you can do is to cough. Coughing is actually another mechanism to clear the airway to allow more oxygen. Okay, you can also try coughing. Coughing also sort of provides applies a bit of pressure on the heart. Okay, so that it can force the heart again to absorb whatever clogs may be there, arteriosclerosis and whatever, the deposit of tissues and plates and all that. It is pushed out of the way, at least whatever little amount. Okay, oftentimes these fat deposits in the blood vessels that cause heart attack. Okay, you may need to go in for a surgery so that it can be cleared. A shunt can be put in the blood vessel or in the heart, whatever. Sometimes it could result in some bypass in the heart and all that. But at least it's somebody that is alive that they can do shunt for. It's somebody that is alive that they can do bypass for. Understand? Now, coming back to cardiac arrest. Now, in the case of cardiac arrest, like I said, it is because of electrical conduction. So what you're doing is the electrical conduction is no longer in rhythm. So because of that, the heart is not going as it should. It's not pumping and relaxing as it should. Understand? So what you do in CPR is, you're trying to make sure that you're trying to restore the heart to normal, the electrical conduction of the heart to normal rhythm. Okay. Now, oftentimes, what happens is, those defibrillators in movies, the caregiver or the nurse, doctor, scientist, whatever, the emergency responder will they will have this machine. You have these two pads that will first rub against each other to natural clear, clear. That's a defibrillator. Now, under normal circumstances, anywhere that people are gathering, an event center, a church, a mosque, every place that people gather, a school, a hospital, whatever, they must make sure that they have at least one defibrillator, preferably the automatic one. Okay? They must have one defibrillator. You understand? Because um in situations whereby the heart is, you've done CPR, you're doing chest compressions, mouth to mouth, providing additional respiration, you're ambobagging and all of that. You're giving extra oxygen, and the person is still not breathing. What you do, just defibrillate. You understand? Now, how do you perform CPR? Let's say you're walking along the road and you see that somebody somewhere, just one guy that is just walking, just slumps. What you do, you rush to the person, tap the person. Are you okay? Hello, are you okay? Are you've asked, the person is not responding. What you do next is you send a signal, you escalate, sound an alarm so that somebody will call 112 or 911. Nigeria 112. You understand? So they can call the emergency response. They start getting ready and they can come down again because the heart is not pumping well, blood is not getting to the brain. So you have a window of 2 to 3 minutes to actually get the heart to send blood to the brain so that the person will not experience brain death. Okay, so you have to do all this. Hello, hello, are you okay? Are you okay? Are you all right? You see the person, somebody help, oh, help, oh, somebody call 112, not 911. Somebody call 112, 112. If you can, preferably you call someone else to do it so that you can attend to the person that is dying. You understand? And as you do that, you check for the carotid pulse. Of course, we have different. Vahrashee, please, in case the time is up, let me know. Okay, because I remember you said we're going to have some time for Q&As. Okay, so if the time is up again, let me know. Right. So that was like CPR. So in a situation whereby
Yes.
okay. In a situation whereby you see that the person collapsed, you have checked, the person is not responding, you have sent an alarm, escalated, you sounded an alarm, and the next thing you do is to clear the environment. Make sure that the person is lying flat on the floor. The person should not have, like, let's say the person has a block on the person's head, or the person has one stone under the hand. No, make sure the person is lying flat on the floor. That way you can now provide enough. You now have a higher chance of providing um, 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 credible chest compressions. Okay, you begin to perform your CPR. CPR is simply cardiopulmonary resuscitation. You are resuscitating the cardiac system and the pulmonary system. Again, that the cardiac system talking about the heart, the respiratory system talking about the respiration, the breathing. Okay. Now, what you do again after you have made sure that the place is clear and all of that, you lay the person flat on the floor. You begin to check. You check the carotid pulse. If you can put your hand, just take a moment. Put your hand on that, just around somewhere around here. Right, just press in. Just press in a little. You will feel your pulse there. Right, the beat as the blood is flowing through the heart. The beating of the force that the blood is exerting on the walls of that's your pulse. Now you check the person. You've checked, you've touched everywhere, and you're not feeling any pulse. None of that person has entered cardiac arrest. The key distinguishing factor between cardiac arrest and any other kind of collapse is the presence or absence of carotid pulse. Now, in a situation whereby somebody, are you okay? Are you okay? The person is not responding, and you check, the person has carotid pulse. Please, by the mercy of God, don't go and start doing chest compressions. Okay, you could instead traumatize the heart, which is another issue on its own. You understand? So first check, make sure that you are actually not getting any pulse at all. You check here, you didn't get any pulse. You've checked the brachial pulse, that's at the elbow. You've checked at the wrist, right here. You've checked, you are not feeling any pulse anywhere. You begin to do your chest compressions. When you do your chest compressions, you interlock your fingers like this. You place the heel of your palm on the chest, right, just around where the heart is, and then you begin to keep your hands straight, and then you begin to press in. Okay, you do the chest compression. The rate is meant to be about 30 compressions per minute. Yes, I'm wrong. About 30 compressions per minute. Okay, so you're supposed to go. There's a space you're meant to go. In fact, I watched a video by what's his name again? Apropos Doctor. Okay, you could go check his social handles on Instagram and what, where he has this song. Um, I don't remember the song, but he has this practical demonstration of how to actually do CPR. So I will advise you go watch it for the sake of our time. Okay? So that you do that for every 30 chest compressions, you supply two breaths. That's where when people say, if somebody fall mouth to mouth, well, that's where mouth to mouth actually comes in. If it doesn't, if the person is having carotid, please don't do mouth to mouth. It's not necessary. You understand? Some people are out there looking for free keys. Save yourself the trouble, and then you have the infection that comes in from contact with the mouth. So please refrain from it as much as possible. Only do it in emergency cases. You understand? Sometimes you can also do. We also have what we call chest compression only resuscitations. Okay, where you are just doing only compressions. Again, you are trying to force the heart to. Now, hopefully, by the time you do all of this, okay, either the person has regained consciousness or emergency team has arrived. Okay, keep doing it. When you get see, please, it's not just for somebody to be there and be massaging the person. No, you're meant to do check. And I will tell you, having done CPR myself on a couple of occasions, and the entire medical community we attest to this as well. Chest compressions is not an easy thing. So as you are doing it, you've done it about 3 to 4 to 5 reps. 1, 3, 4 to 30. You supply oxygen. You have ambu bag. If you have ambu bag, there's a pocket one. You have ambu bag. You give. You don't have. You do mouth to mouth. 1, 2. Supply 2 breaths. Go again another 30. That's so compression 30. Air supply 2. That's 1 rep. Okay. Again, breath 30 ratio 2. Okay. You do that 3 to 4 to 5 times. Where you're getting exhausted, tell another person to take over. Okay. And remember, as you're doing chest compression, your elbows should be straight. You shouldn't be bent, so that you can apply enough pressure, enough force. Into this. It's been an amazing time. I hope you've actually learned something. There's another situation, a condition that I also want to talk about. Seizure. Okay. I wanted to also talk about seizure, but our time is far spent. See, we have only 7 minutes to the end of tonight's session. Yes, thank you very much. Vahrashee, are you there? So you take over the mic. Okay. So, do we have any questions, any comments I should pay attention to? I hope I have answered the questions that were asked about. Okay. How do you know if a person has internal bleeding as a result of an accident, and what do you do before evacuation? Now, in a situation whereby a person has internal bleeding, usually most of the times the signs you look out for. Let's say somebody has an accident now, you can examine the person. If the person is conscious, you can ask the person having any pains anywhere, the person feels uncomfortable anywhere. Okay, so let's say the person is having bleeding around the ribs, right? Let's say if there's a fractured rib, right? Then ask the person, are you having any pains anywhere and all of that? The person says, my ribs are paining me. You touch, you can remove it if you are in a situation whereby you can remove the person's clothes or have the person to remove their clothes. You can, lift the person's clothes, look at the area. If there is a discoloration of the area, the area is beginning to have red spots or is beginning to look darker than the surrounding area, the color is looking different from the, you begin to suspect that there's most likely an internal bleeding in that place. When you touch the place, you see that it is soft to touch compared to surrounding areas. Again, you begin to suspect that. So in that case, being that it's an internal bleeding, you are not seeing where the bleeding is coming from, please send the person to the nearest hospital for management. And oftentimes, before management takes place, they'll first of all need to do a scan, do an X-ray, the investigations that need to be done to check and look at the place very well to make sure that the bleeding can actually be arrested. Find out where the bleeding is coming from. Okay, so that you don't just go and open, you just go in blind, and then you are thinking it's just the ribs are punctured, something that caused an injury. You don't know that the liver is affected or the pancreas is affected, and then you go in blind and you receive shock of your professional career. So investigations have to be done. In situations like that, you just look. When you see signs of discoloration, you see pains, there is tenderness in the area, please escalate immediately to the medical team. Okay. I hope this session has been helpful. Has it? I'd like to see comments. I didn't ask. I'd like to see comments. Have this session been helpful, anyone? Vahrashee, over to you, sir.
Wow, that was my head is still like this. Actually, fire. I knew it would feel from the comments.
Thank you very much for
Thank you for
having me.
the.
Thank you.
Um, I think we have to never declare that. But for like,
So
we have to continue on this topic.
absolutely, that was fine. Thank you very much for that. That'll be
If
thank
we
you very much for part
two
two.
on two of this,
Sure.
but actually for the
Thank you
value
very
you
much for
just
having me.
shared, I'm just so grateful. Everybody grateful for joining. Thank you for you know times that you want you just open our mind that okay, oh, you can't just sit down, just carry what I'm working on it, right? You need to know
There are things.
actually actionable on on recognize my possibly go wrong. And it's always advice and turn it also that
Yeah.
trying to save a life, we should also reach out. So
Yes.
before help comes, what to
I
do.
think there are things you can do.
So
Yes.
thank you so much for this.
Yeah. Sorry. Just to point out, just to
Yeah.
throw a little more light on what you just said. Okay. See, look, you are not a trained professional. You're not a trained expert. Okay. So if you know that you don't know something very well, instead of going in, okay, and sometimes causing even more problems for the trained, the experts, please just let the person. Okay, pray for the person. Intercede on the person behalf. Okay, because sometimes the good you think you're doing could be causing more harm if you don't know how to. So what I would expect people to do from this point is, you step out. At the end of this session, you can go. Again, there are lots of resources online these days. YouTube, there's almost nothing you want to learn that you won't find on YouTube. Okay, there's almost nothing you want to learn that you won't find on YouTube. So what you can do is you can go to YouTube, how to perform any maneuver or emergency response in case of choking. Okay, how to tie a tourniquet. Okay, in case of bleeding. Okay, how to perform CPR. Okay, these are questions that how to respond in case of seizure. People believe that in case of seizure, you begin to fight the person to open their mouth and shoot the inside of the mouth. There is no why you should do that. You could actually because in case of and we'll talk about that. So, yeah.
Thank you so thank you for that light actually grateful. And then has but then questions. I think we have a WhatsApp group where to join. So the I will make sure is the lastly go Martin is Facebook.
Yeah.
Are you on
Yeah,
LinkedIn too?
I'm on LinkedIn as well.
So drop his tool on WhatsApp and on Instagram. So you go and follow him. There's a lot of- I don't have to hide. So